The A codes are grouped as A1 and A2. The A1 codes are those having to do with outreach and application assistance for the Oregon Health Plan, Oregon's program for the administration of Medicaid. This code should be used for informing individuals on how to access, use, and maintain OHP, assisting in early identification of individuals who could benefit from OHP health services, explaining OHP eligibility rules and process, and assisting individuals to complete an OHP application, including translation and comprehension activities. A1 codes are divided into 7 subcodes. A1 has the most subcodes of any of the activity codes. Don't worry about trying to memorize all of these subcodes right away. Remember that the online survey form gives you multiple notes, prompts, and examples of all of the subcodes in the form of convenient drop-down boxes. As you get more familiar with the MAC codes, please do try to code your time as close to the relevant activity as possible. If, however, you're not able in a specific situation to decide whether it is best documented as an A1.1 activity, where you inform either an individual or group about benefits and availability of services of the Medicaid program, or an A1.2 activity, where you inform an individual on how to access and use those services, don't sweat it, choose one and move on. There are some subcodes that are pretty specific to easily identifiable activities, one of them being A1.5, check a person's OHP status. This is an activity which is likely to happen multiple times on any given day for some admin staff and occasionally for clinical and or management employees. A2 is a code that should be used to denote outreach and application assistance for programs and services that are not the Oregon Health Plan. Examples of A2 activities include informing individuals on how to access other non-OHP covered health services, such as weight loss classes or fitness training, informing individuals about other social service programs, such as TANF, SNAP, etc., and assisting individuals to complete applications and or enrollments for the above services. You'll note that the A2 code, as is the case for the other codes under the letters B, C, and D, does not have subcodes. For example, there's no A2.1 or A2.2 subcode. Activities under A2, B2, C2, and D2 do not require further specification. Activities under B1 cover a broad range, and it is likely that most of those in your department's cost pool, the largest portion of their time, will be coded with one of the B1 subcodes. They include case planning activities for OHP covered services, not including TCM, monitoring the delivery of OHP covered services, making referrals for and or coordinating medical, mental, dental health, or substance abuse services covered by Medicaid/OHP, agency staffing and consultation on health and developmental issues, and gathering background information that may be required in advance of referrals. These types of activities are denoted by 5 B1 subcodes, each specific to an identifiable set of activities. B1.1 is a subcode to use when you have referred a person for medical, mental health, dental health, and substance abuse evaluations and services covered by Medicaid OHP. This includes all time spent gathering information in advance of referrals. B1.2 is for the time when you have coordinated the delivery of medical health, mental health, dental health, and substance abuse services covered by Medicaid OHP, including participation in multidisciplinary team meetings, conferencing on health, developmental issues, consultations, and preparing or presenting materials for case review. B1.3 is the subcode to show that you've monitored the delivery of medically related Medicaid-covered services. B1.4 codes for time in which you participated in, coordinated, or conducted a training on Medicaid administrative claiming and/or on certain service delivery-related training. And finally, B1.5 codes for staff travel or paperwork related to the above referral, coordination, monitoring, or training activities. Now for a closer look at each of the B1 subcodes. B1.1 is for an activity that refers a person for medical, mental health, dental health, and/or substance abuse services covered by the Oregon Health Plan. This includes scheduling an appointment for a client to see a service provider at your department or at a private clinic, at a physician's or dentist's office, or at a hospital. Calling a client or a list of clients to remind them of a scheduled appointment or of an upcoming event or program that is relevant to their health or to that of someone in their household. For example, calling parents to remind them of immunizations due to their children. B1.2 is the code that covers a spectrum of activities that help to coordinate the delivery of medical health, mental health, dental health, and substance abuse services provided by OHP. These include participation in multidisciplinary team meetings, conferencing on health and developmental issues, consultations, setting up and closing down clinics, and preparing or presenting materials for case review. B1.3 covers monitoring of direct services that have been scheduled and/or completed, either earlier on the same day when they were scheduled or completed, or on a previous date. It is irrelevant whether that date was a MAC survey day. For example, an office specialist may be tasked with contacting patients of the department's medical staff to follow up with the patients in determining whether or not referrals made to them in the previous week by the medical staff to a local clinic resulted in appointments either during the week or in the future. We'll see a couple of other examples of monitoring a bit later. B1.4 covers participation in, coordination of, or conducting a training on Medicaid administrative claiming and/or other training aimed at improving delivery of primary health or behavioral health services. If today is actually a MAC survey day, the time that it is taking for you to attend this webinar should be entered into your survey as B1.4. If you are an individual designated by your local MAC coordinator as a local trainer for MAC, and you provide training to one or multiple fellow cost pool members on a survey day, you will also use this subcode to code that time. B1.4 may also apply to other trainings that may take place on a survey day. If the training aims to improve the capacity or capability of attendees to deliver services directly related to primary health care, assess underserved populations in order to enhance their access to that care, and to identify and mitigate barriers to that access, then time spent attending or providing such training is claimable using the B1.4 subcode. Finally, B1.5 is a subcode for travel or paperwork related to these referral, coordination, monitoring, or training activities. For example, if the training just described is being provided at a location a distance away from the cost pool member's workplace, the time to travel to and/or from the training can be coded as B1.5, as long as it takes place on a MAC. Before we move on to the other codes, this is a good place to reemphasize the important point we made a few slides back when describing E-coded activities, and to clarify a key distinction between claimable and non-claimable time that most often impacts B-coded activities. The distinction, the dividing line, if you will, can be summed up in 2 words: case management. Recall that direct care activities will always be coded E. Any case management activities also fall under this code, and any service that a case manager provides to his or her patient, whether or not it involves medical or mental health diagnosis or treatment, is going to be coded E. This will include referrals to other health providers, coordination of services, monitoring, and any other services provided by the patient's case manager. All of these activities are extensions of the direct service that a care provider gives a patient, and thus are coded exactly the same as the direct services themselves, that is E. So, are there any situations where a skilled professional isn't providing direct care or case management? Well, let's look at a few scenarios to find out. Scenario number 1. You are doing a home visit, and the mother of the child who is your patient announces that she is pregnant. You ask her some questions and give her a referral. You can count the time as B1.1, which is the subcode for giving referrals. Scenario number 2. You are doing a home visit, and a sibling of the child who is your patient comes into the room and is clearly in need of medical attention. You ask some questions of the sibling and the parent or parents, do an assessment of this child's condition, and give a referral. Again, you count the time as B1.1. In both of these scenarios, the individuals being helped are not your patients. The child who is the subject of the home visit is. In both cases, you can also code the time traveling to and from the visit as B1.5. Scenario number 3. You are part of a multidisciplinary team that is discussing several students who need coordinated health, mental health, and other services for themselves and their parents. None of the children are your patients, and so you can count the time during the team meeting as B1.2, since you are helping to coordinate care for these students and their families. In this case, you are not the case manager. Instead, you are wearing your consultant hat. Scenario number 4. You are at a school carrying out your duties as a school nurse or school mental health counselor. During your time at the school, you may see students asking about STDs, faculty concerned about kids acting out, parents with questions about immunizations. None of these are patients of yours. You do not have their names in your files or consider them part of your caseload, and so you are wearing your consultant hat, giving consultations that are helping to coordinate care, or at least access to it, that can be coded as B1.2. Some of these consultations may lead you to make referrals, so if some or even all of your time is coded as B1.1, that's okay too. Scenario number 5, and you've got your consultant hat on again. This scenario usually will also happen at a school, but it could take place in any location where you are providing advice or instruction to an individual or a group on specific health issues in which your status as a skilled medical or mental health professional is key. It could be given in an adult class on ways to prepare for infectious diseases, to parents on the correct way to install an infant car seat as part of a preventive health protocol, to a school health class on nutrition, or to a local nonprofit on ways to deal with clients' behavioral health issues. Since this activity is supportive of a specific primary and mental health outcome of specific clients who are not your patients, it is claimable under the coordination subcode of B1.2. Okay, time to put the E hat back on, and this time it has on it both the case manager label and another label, delegator. On a MAC survey day, Nurse Wally notes that it is time for his patient Joan's annual wellness check. So he asks office specialist Betty to check his schedule for an appropriate slot and then call Joan to set up an appointment. Betty codes her time on scheduling and calling Joan as B1.1 referral. Let's say that the day of Joan's appointment with Wally turns out to also be a MAC day. When Joan comes in for her appointment, she informs Betty that there have been a few changes since her last appointment. She has a new GP, she's moved to a new address, etc. The time that Betty takes to update Joan's file is coded as B1.2 coordination. Betty then sends Joan in to be seen by Wally. After a physical exam, Wally gives Joan an immunization and then refers her to the department's WIC program. Now let's say that the next step for Joan is a few days later and that, by golly, it just happens to also take place on a MAC survey day. On that day, Nurse Wally asks Betty to follow up with Joan to see if she has had any adverse reaction to the immunization. Betty then calls Joan, finds out from her that she is having a bad reaction, and so Betty then informs Wally. The activity is one in which the condition of a specific individual is being monitored, and so it is coded by Betty as B1.3 monitoring. Wally then calls Joan to get details of her condition. After giving it some thought, Wally decides that he needs a second opinion, and he goes to the office of his supervisor, Lynn, to discuss Joan's case. Lynn, a nurse practitioner, discusses Wally's patient and codes her time as B1.2 coordination. Now let's review. Every activity that Wally is doing in this scenario, he is doing as either a direct service, both the exam and the IME fall in this category, or an extension of direct service for his patient, Joan. So Nurse Wally is either wearing his direct service hat or his case manager hat, but there's another hat that he also puts on from time to time, and that's the hat labeled delegator. By delegating some important activities to office specialist Betty, such as scheduling Joan's appointment and monitoring her condition, Wally is able to increase his department's claimable time, even though everything that he does is coded with the non-claimable E code. His fellow cost pool members, Betty and Lynn, can claim their time with one of the B1 codes. Notice that even though Lynn is a skilled medical professional, she can claim her time because Joan is not her patient. Okay, let's do a quick recap. We've seen how a skilled medical professional, or SMP, can put on a delegator hat in order that others in the cost pool can claim B1 time for activities done on the SMP's behalf. And we've seen how an SMP can, in some cases, claim time spent in supervising case managers as B1.2. Can this same code be applied when you are advising a peer on a specific case or cases when those cases are not under your management? Yes, it can. Finally, when you are conducting a developmental assessment, such as a ages and stages questionnaire on a child for the first time as a means of determining what kinds of services you will refer that child to, you can use the B1.2 code since the child at that point is not your patient. We've shown how activities like setting up appointments or pulling charts and otherwise preparing patient files for an upcoming appointment are claimable tasks indicated by one of the B1 subcodes. What other types of activities can be coded with B1? We've previously noted that B1.3 covers monitoring activities such as following up on behalf of a case manager to check on results of services recently provided to his or her patient or patients. B1.3 can also cover time spent on checking to find out if a scheduled appointment was kept as a quality assessment strategy of utilization management. Also, this subcode is appropriate for time spent on contact tracing. That is, following up on an individual who has tested positive for a highly contagious virus, determining which other persons that individual has recently been in physical proximity with, and then contacting those individuals with the same queries in order to inform them of the need to self-quarantine and to get tested themselves. Contact tracing is an effective means of limiting the spread of a virus like COVID-19, and the B1.3 subcode is the way to have MAC reimburse the activity. We've covered the sort of training that can be claimed through the B1.4 subcode, but before we leave the B1.5 subcode, it bears noting that this subcode covers not only travel associated with B1 activities, but also certain types of paperwork. A couple of examples would be a report written on a MAC survey day, giving an account of the B1 type of activities accomplished on that day. For example, an assistant to a direct care provider who at the end of the day logs all the services done by the provider that day, and to whom would enter the time spent on completing the log as related paperwork, B1.5. And as an incentive to get your MAC survey done on the survey day itself, you can count the time it takes to complete the survey as B1.5, which is time you can't claim if you're completing the survey on a subsequent day within the 5-day window for entering the data. Speaking of data entry, although some data entry activities are claimable as we've seen, not all of them are. When information that is important to a client's file is entered into that file when that patient is scheduled or arrives for an appointment, then the time to update the file can be counted as B1.2. It is an activity that is part of ensuring proper coordination of services to that client. Note that the claimability of the activity is dependent on the client getting connected to services. If the file is updated in another circumstance, the activity is counted as a general filing task and thus coded F. Let's say that on a MAC survey day, client Jane comes into the office for an appointment to receive services having to do with primary or mental health or substance abuse. Office specialist Betty, who is doing intake, asks Jane if the information currently in her file needs updating, and Jane says that yes, she has a new GP, she's moved, her phone number has changed, etc. Betty makes the changes to Jane's file before sending her to be seen by other clinic staff. Betty can count that time as B1.2. Later in the day, Betty is doing intake at a clinic, registering information into a database on each client as they arrive to receive clinic services. This time can also be counted as B1.2. Note that in these cases, data entry is made that is directly related to specific clients receiving specific services. Later that same day, Tom, who is a patient of a clinic staffer, calls in to let Betty know of changes in his situation similar to those of Joan, and Betty updates Tom's file. But Tom does not make an appointment, and so Betty counts that time as F. Again, note that data entry in Jane's case was made in conjunction with her receiving services. It was a part of the process of her actually getting connected to those services. Tom, although a current patient of the clinic staff, is neither receiving services that day nor getting scheduled for services at a later date. He is just calling in to have his file updated. The activity is not connected to the client's actually getting connected to services, and so it is not claimable. Now let's say that later that day, Betty is tasked with calling a list of clients who are parents of children due for immunizations to determine whether those kids are up to date on their shots. As she gathers the information, she updates an immunization registry database kept by the department. This is a monitoring activity that is claimable with subcode B1.3. Contrast that activity, which records that specific healthcare services have actually taken place, with the activity of setting up and maintaining a database like an immunization registry. For example, if Betty spends most of a survey day entering names into a registry and or changing things like contact information connected to those names, the activity is not claimable because none of the people in the registry is getting connected to services through the activity. Similarly, moving data from one place to another, like reorganizing files or changing data from one format to another, like digitizing paper records, is not claimable. Again, no clients are being connected to services during this process. Both of these types of activities will be coded F. We spent a lot of time discussing the B1 subcodes. We'll now say a fairly brief word on the other side of the B activity coin, the non-claimable B2 code. This is the code you'll use to show time you spend on any referrals, coordination, monitoring, training, and travel or paperwork that connect clients with services that are not medical, not related to behavioral health, or not having to do with substance abuse. So use B2 for time connecting clients to social health programs like food banks, shelters, job skills training, etc. Also to government assistance programs such as food stamps or SNAP, TANF, and so on. You also use B2 for referrals, etc. to WIC.